to our questions. I have 3 questions. I hope I can get through them. The first is to Dr. Buchman. And, Dr. Buchman, you have talked about the stress on the system. There's also stress on the supply and demand of healthcare professionals in the system, with shortages of frontline staff and primary care staff and physicians. And I refer to a available but latent resource, which is qualified international medical professionals. BC, and I know it's a complicated arena with provinces being responsible for healthcare and regulating bodies being responsible for who gets to practice or not. In the current crisis, BC and Ontario have made some tiny changes, not very big, but really tiny. When I look at what other nation states are doing, like Spain, Ireland, Germany, France, Peru, Colombia, Argentina, they are being far more proactive in embracing the talent that is there to deploy it in the crisis. Do you believe that the federal government should do more in the current crisis to open up pathways in cooperation with the provincial governments and licensing bodies? And I think particularly of the crisis of care in long-term care homes. Is there not an opportunity here to meet the needs of our senior citizens and to deploy the talent that is already here and underutilized?
Well, thank you for the question. And it's been a question that has been simmering and that we've been dealing with at the Canadian Medical Association. I just want to first state that the group of physicians that we're referring to are international medical graduates. So yes, graduates that have received their training. And Canada is, we wouldn't even have a healthcare system or provide the good care that we do provide without the contribution of international medical graduates. These are often very well-trained physicians who are willing to go out to rural and remote areas in order to be able to serve the Canadian public and get integrated into the system. So having said that, and the fact that we were able to flatten the curve during COVID-19, the actual surge in demand that was anticipated to overcome our healthcare system's capacity to deal with this didn't fully materialize. And that was good public health measures, physical distancing, et cetera. We have been approached by international medical graduates who clearly want to help and want to make a contribution. We've deferred to the federal medical registries of Canada, FEMRAC, who is the ones that are looking over all the medical regulatory authorities. And so far, they haven't seen the need that has been present in other countries to get enough IMGs certified to be able to practice at this time. I think the problem, though, goes deeper. I think it relates to our whole lack of national health human resource planning in Canada. Physicians, nurses, nurse practitioners, pharmacists, social workers, OTs, etc. We don't have any national entity that looks at what we need, particularly as you referred to long-term care and seniors. We have no concept of how many geriatricians we need for the future. We looking 10 years hence or 20 years hence, we have no ability to plan for that. We have about 10 times the number of pediatricians graduating now compared to geriatricians. So this becomes a much bigger, complex issue. I think based on what FEMRAC says to us, that just licensing enough international medical graduates at the present time wouldn't actually solve the problem. Their feeling, and they should be consulted, is that we need to ensure that all the IMGs are competent and capable within our culture. And so it's worth a national discussion for sure. I don't think there are simple answers. There's a much bigger picture.